As India braces for dengue season, Sneha Mordani brings you this detailed report on the impact of dengue, the symptoms to watch out for and how one can protect themselves.
It is that time of the year when dengue, a viral fever, resurfaces. July to November is when an upsurge is seen in the cases of this disease. Well, this usually peaks after the heavy monsoon showers.
The vectors which are responsible for the spread of such diseases tend to increase during the rainy or after the monsoon season. So adequate control of these vectors are absolutely essential for the curtailing of the diseases such as dengue, chikungunya and malaria.
Dengue virus is transmitted through the bite of a female Aedes mosquito. This mosquito can't breed in lower temperatures, so start of the winter season usually means relief from the disease. 16 degrees and more is what is required or ideal for the Aedes mosquito to breed. Common symptoms of dengue fever is temperature lasting 2 to 7 days, rashes, itching, weakness, flushing are some of the most common symptoms of dengue. The most worrisome complication, however, is hemorrhagic manifestation.
So let's discuss about dengue hemorrhagic manifestations. Dengue fever is known to cause low platelets. So that may result in gum bleeding, then nose bleeding, then there can be reddish rash all over the body. Then people can have reddish stools or even black stools sometimes, or even the urine can be reddish in color.
When then is a patient said to be suffering from serious complications? Well, doctors say when there is persistent vomiting, fluid accumulation and abdominal pain, then it is time to admit the patient to hospital. What about home remedies then? Consumption of papaya leaves using adequate fluids, drinking water using basil or tulsi leaves or pomegranate juice are considered some good remedies to manage the disease. Listen in to what the doctors say about the do's and don'ts.
Very specific do's and don'ts for dengue fever. So first of all, if you're suffering from dengue fever, you tend to get dehydrated. So take large amount of fluids in whatever form, but take large amount of fluid so that you're not dehydrated. If you have fever, use tablet paracetamol only. Paracetamol is not to be given more than 4 times a day. If the fever still persists, you can do cold spongings. And you should consult a doctor even if your illness is mild. You might have a bit of vomitings, you might have a bit of pain abdomen, you might have a bit of swelling in the liver, so your doctor can judge all these things. He can order tests and he can give you the remedies as and when needed. So just consult a doctor even if the disease is mild. There are few don'ts which have to be very strictly followed. As it is a viral disease, no antibiotics are to be used and no steroids are to be used. Please don't self-medicate, don't go on the wrong messages. These 2 drugs, no steroids, it is the main rule, and no antibiotics.
There is no vaccine yet against dengue. Adhering to precautionary measures and preventive protocol is actually the only way forward. Wearing full-sleeved clothes, using mosquito repellents and disinfecting standing water sources is the way forward.